This video shows a case of missed abortion of about 9 weeks. The terms early fetal death refers to condition in which the fetus is no longer alive but the uterus has not yet started to expel its contents. A variety of terms were previously used to describe this condition, including blighted ovum, missed abortion, and silent miscarriage. Miscarriage is a word used to describe the early loss of pregnancy but before 20 weeks. It usually happens in the first trimester. Unfortunately, between 10 and 15% of known pregnancies and in miscarriage, there are three hypothetical causes of fetal demise in the first trimester. First, previous fetal infection, the primary viral infection of the myocardial cells, initially causes myocarditis, leading to hydropic cardiac failure and demise. Second, bone marrow transient aplastic cirrhosis occurs as the premium movements for anemia, leading to sequence of congestive heart failure, hydrophus death. Third, placentitis without fetal infection causes placental dysfunctional and ultimately fetal demise. IUGR has various causes. The most common causes is a problem in the placenta, the tissue that carries food and blood to the baby. Birth defect and genetic disorders can cause IUGR if the mother has an infection, high blood pressure, smoking, drinking too much alcohol, or abusing drugs, her baby might have IUGR. Women who retain the dead embryo fetus can experience severe blood loss or develop an infection of the womb. These are rare complications. Some babies die in the uterus, means womb, before they are born, called intrauterine fetal death. It can happen during the last half of pregnancy or more rarely during labor and birth when it is known as intrapartum death. When a baby who has died during labor and birth is born, this is called a stillbirth. Although a variety of terms are used to describe early pregnancy failure in the presence of clear-cut sonographic evidence that a non-living embryo is present, the term embryonic demise should apply. Ultrasound diagnosis of miscarriage should only be considered when either a means gestational sac diameter is equal to or more than 25 mm with no obvious yolk sac or a fetal pole with a crown rump length equal to more than 7 mm. Without evidence of fetal cardiac activity, transvaginal ultrasound is the mainstay in the diagnosis of miscarriage. A missed abortion is a non-viable intrauterine pregnancy that has been retained within the uterus without a spontaneous abortion. Typically, no symptoms exist besides amenorrhea, and the patient discovers that the pregnancy stopped developing earlier when a fetal heartbeat is not observed or heard at the appropriate time. An ultrasound usually confirms the diagnosis. In addition to sign of fetal life on sonography, subchronic bleeding is an essential factor affecting the outcome of gestational in patient with clinically threatened abortion. The most common causes for first trimester